And today marks 392 days since our first case. We're week 57, hard to believe. And thank goodness no one passed away. But to the 366 families, my prayers and condolences continue for your difficult time. And, to anyone that lost a loved one. But as of yesterday, we had 41.8% of Albany County population has received its first dose of the vaccine. An estimate of 28% have completed their second dose. So 41 and 28%, which is good numbers. We're going in the right direction. Compare that to the statewide average. It was 34.4, and the full vaccine rate was 21.7. So again, people, I appreciate you going out there getting the shot. Please continue. We got a lot of PSA commercials out there. Dr. Whalen has the one with Dr. Bennett and a variety of other people that are on there about, don't hesitate, vaccinate. So please continue to do that. Today, Albany County has administered or reallocated 42,952 first and second doses of COVID-19. Albany County alone has administered 27,904 at our clinics at the Times Union Center and the CAP Center. Yesterday, our Department of Health team administered 1,141 second doses, and we're expecting another 1,400 doses in the arms today. And I actually got to stop by and see the pod yesterday again. It's great to see the smiling faces, see a lot of familiar faces, but to see Dr. Whalen and her team, really how smooth they make it, how friendly they make it. And I got to talk to one of the workers, and I was saying this to Dr. Whalen on my way out, that she did have a Yankees mask on, but I didn't want to hold that against her. But she was from another county, and she said how nice it is to work here with our health department, and had nothing but great things to say about our health department and volunteering here. So I did appreciate that feedback. But I also got to run into Bethlehem Town Supervisor David Van Leuven, County Legislator Sam Fine, got to see Tom Nardachi there, and plenty others. So it was neat seeing everyone there and all the county workers from our water purification district getting their second shot. I know there was one worker there from that I had to talk to a little bit. Was a little nervous, but we got him through it, and it's good. A great team down. We got out of water purification. So we also got to partner with Albany, Russell Sage, Siena College on a vaccine pod earlier this week. To President Gibson, thank you for everything you're doing up there, for not just the administrators and the teachers and the friars, but for the students and the way you put your game plan out there. My deputy Dan Lynch still talks about it, how it was the day we sat there with the supervisor Paul Mahan, and he laid it out like a war zone. I got what he was saying, but it was a great tack from the beginning, and it's a great plan to follow through for the safety of just not the faculty, but for the safety of the students and for the community. So again, that's great. And there was 1,200 shots that went out in total. So again, to Dr. Whalen and her team, and us allocating it and working in a partnership, because as I've said since the beginning, the last 57 weeks, I feel like a broken record. It is a partnership. It is working together. It's leaving the egos out the door, not pointing at the finger when somebody gets something wrong, but coming together as a group to work for the people that put us elected officials in office, but also the people that are entrusted in our county departments that have to deliver day-to-day services that people rely on. And they need continuity, they need partnerships, and they need results, and they don't need egos, and they don't need excuses why they can't get something. So I do want to say thank you to everyone. We're also discussing with the College of St. Rose to get their students vaccinated, hopefully next week. But I do want to remind everyone, please, the 16-year-olds, you're eligible, register, get your shot, do your part, help us get closer to opening up the lights at the end of the tunnel. We're getting there, but we need your help to get there. So please, please. It's also important we need to get teenagers, those in their 20s, vaccinated. They're not getting sick, which we have pointed out. Dr. Whalen and I have said this for the last 57 weeks. We should actually do the board again to show where the numbers are at. But one of the things early on I noticed was a trend between 19 and 40, that age group in 19 and 20, that really was taking off with infections. They weren't getting sick. They weren't ending up in the hospital, but they sure as heck was spreading it, COVID-19 around. So just to give you a little bit of the health data, between February 12th and April 6th, the number of infected among the age between age 10 and 19 increased by 425. That's an increase of 23.4% increase. Over that same period, infections among the in their 20s grew 993, almost 1,000. That's an increase of 23.5%. In fact, just over the last 8 days, the number of infections among those in their 20s jumped to 153. Like I always say, follow the science, follow the math, follow the numbers. The weather's here. Kids are coming back to school. They're going out. The masks are starting to be relaxed. Please don't let your guard down. We're just asking you to do your part. Continue to do your part to keep us moving in the right direction. And if you continue to do this in the right direction, we will get to 70%. We will get the vaccine out to everybody, and we can get back to some type of normalcy. The world will never be what it was 57 weeks ago. It's changed, people. The workplace is always going to change going forward. School is going to change. Things we've learned how to teach online. We learned a variety of stuff. Zooms was good for some people, bad for others, the ones that didn't get it. But we learned a lot. And technology here in the county, we've gone 10 years into the future. It's just adding new programs and new concept of how we can deliver services going forward. So you're going to see a change at the county government. That has been a change for the last 57 weeks, but it's going to change well into the future. So again, please continue to do your same thing. And you can compare these numbers to age groups with the third highest number of infections, those in their 50s, between February 12th and the 6th. Infections grew by 13%. So we need to get our younger people vaccinated so we can stop the spread and get the situation under control ahead of the summer, the amount of vaccine that we're getting, that President Biden is pushing out there. It's one of the things, and I say this, and I was talking to Dr. Wendland about this yesterday, and I hope for the sake of her department that I'm hoping by June's our last pods, and they can get back to some type of normalcy in the office, and we're not going to see these mass pods going on through the whole summer, because there's going to be so much vaccine coming out this month and next month. If you want the shot, you'll be able to get the shot. There'll be no excuse. And I will say this, I know there is some hesitation. Talk to your doctor. Talk to people that have gotten it. Please do your part. Be part of the solution, not part of the problem, and we'll continue to get through this. As a quick reminder, those that are age 16 and 17 that are eligible to receive the Pfizer vaccine, you must have a parent with you or have a note signed from your guardian that you can take this. We are doing our first high school pod tomorrow. Not tomorrow. Tomorrow's Friday. Sorry. Saturday at Bethlehem High School. So we'll be the first students, I believe, in a high school that's getting it. Jay from Crestwood Pharmacy Partnership, getting it done. Jay, thank you for what you're doing. But that will be the first high school pod this Saturday. I'm encouraging, we will be reaching out to superintendents, but again, it takes the logistics of the parents either being with them or them getting a note signed that they can get this vaccine. And get kids back in schools, because that's what parents want. That's what, as a dad with kids, I want. I want to see our kids in there, but I can assure you, and I don't want to speak for Dr. Whalen, but I can assure her and I have not said what we said for 57 weeks. We want to protect the residents first and foremost. That's our job. As of today, there's 22,708 cases of COVID-19 in Albany County to date. 65 new positive cases since yesterday. Yesterday, we saw 52 new cases. The day before that were 45. So we went from 45 to 52 to 65 today. Kind of going up a little bit. We just got to be careful. Just please watch it. Please, by all means, go get your COVID-19 test. It's not over with. It's not done with us. Please, if you think that you've been exposed or any reason, go get tested. Our 5-day average was 58.8%. Yesterday, it was 57.8%, so we went up a little bit there. There's currently 1,248 people under mandatory quarantine. Yesterday it was 1,218, so we climbed up a little bit there. Out of the positive cases of 65 today, 15 were healthcare workers. 3 are residents of a living setting. 3 reported traveling out of state. 44 don't have a clear source of infection. As of today, 22,269 people have tested positive and had fully recovered. Fully recovered where they're at a hospital, didn't go in the hospital, but had it and recovered. But again, I remind people, there's people that are going to be recovering from this for a long time to come. We had an increase of 74 recoveries since yesterday. Unfortunately, we've seen 5 new hospitalizations overnight, so there's currently 26 people in the hospital. And yesterday, the number was 24. There are currently 7 patients in the ICU. There were 6 the day before. That slightly has gone up, and our ICU has gone up over the last week and a half. So we got to keep an eye on that. Albany County 7-day average for positive rate is now 2.2. Capital District is 2.3. So we got to watch that a little bit too and keep that number down. I continue to encourage everyone that are celebrating in large groups like Passover or Easter, please just wear your mask, cough into your arms, clean your hands, stay 6 feet apart. Dr. Whalen can talk about it more than I can. There's guidelines from CDC. If you're all vaccinated in the same room and everyone had their second shot and you're past that window, which Dr. Whalen has talked about a lot, you're past that window where you have the antibodies, you don't have to wear a mask. You can socialize. But if there's one person in that room that hasn't had their second shot, first shot, no, everyone should have a mask on. So I know it's kind of confusing at times. I know people are getting tired, but please continue to do it. Check if you're eligible. Hotline 1-833-697-4829. Everyone should be eligible now. So please, 211 is still there. I was talking to United Way the other day, to Peter, and they're still getting a lot of questions, and people are still having a hard time navigating and finding appointments. So please go to our pre-registration. It's at albanycounty.com. You can go on there. You can hit the link. You can pre-register. It's easy. Fill it out. You'll get a text message, an email from us. You'll get your appointments, and it takes the anxiety away. So I know people are still trying to do that. We partnered with Schenectady and Rensselaer County, so we'll make sure you get in the right county. So for the last 56 weeks, how important our healthcare workers have been to us. I mean, seriously, they've been on the front line, our nursing home, our health department, and everyone else. So, I do want to say to all our healthcare workers who've responded to COVID, to recognize them for National Public Health Week and say thank you. And on that note, the person that's been leading it on our healthcare, Dr. Whalen.
Thank you, County Executive McCoy. So we continue to get vaccines out. And again, the reminder to everyone out there is if you are 16 or above, you are eligible for a COVID vaccine. The vaccine that's right for you is the vaccine that's available. We have clinics running today at the TU and have been working with a myriad of partners to continue to get vaccine out, and are very proud of the statistic that Albany County residents are leading in the number of percentage of vaccinations. This is a strong turnout of the public to come get vaccinated. It's a good sign, but we continue to encourage people that are newly eligible and those that have waited a while to come and get vaccinated. This is the way that we get through this pandemic, is vaccination and continuing to practice the mitigation behaviors. So all of this continues to be essential as we go forward, and it is not the time now to let guard down. Masks are still essential. We still are seeing cases in the community. We are still seeing people that are hospitalized and still seeing people in the ICU. Still, unfortunately, seeing people dying from COVID. So it is essential that people continue to practice essential public health behaviors and to sign up for vaccine. The pre-registration list is being used by multiple partners, not just Albany County. So if your name is on that list, we're hopeful that we will be able to direct you to a vaccine clinic in the near future. This is a great effort, and there are many partners involved. The hub site and our website are always good sites to look at to determine where you can get a COVID-19 vaccine. But again, it's important for people to realize that most vaccine clinics are scheduled with very short notice in advance. So if you don't find an appointment today, usually it's good to start looking early in the week. Usually we release our pod times and availability on Tuesday at 5 p.m. And we appreciate everybody looking for those appointments and coming to get vaccinated. We look forward to seeing 1,400 people at the TU this afternoon. And, our operations have been running very well. And that is entirely due to the staff that we have and to the volunteers that have turned out in droves to sign up for the Medical Reserve Corps and have become the backbone of our effort at the Health Department. As the county executive indicated, this week is National Public Health Week, and this is the week where we take time to recognize the achievements of public health across the country. I'd like to use the next couple of minutes to highlight the work that our department does, including the unprecedented work that staff has accomplished in the last year, and also highlight the everyday work that we do to help public health in Albany County.
Thank you, Dr. Whalen, and you have been extraordinary, and you knew that. And Dr. Applegate, yes, I got her name right because she was yelled at me yesterday, but she is right. And thank you for your leadership in the Department of Health and everyone out there doing this. So, and being on the front line, thank you so much. Also, Albany, believe it or not, had its 1 year pod up. So they took a picture. It was on Facebook, I think, yesterday. It was 1 year that the Albany site's been going. So it's almost hard to believe that it's been over a year now, but we're getting there. Please, people, continue to do the right thing. I encourage everyone to go to our website, albanycounty.com, to view all the different testing locations across the county. They're available. I don't know how much longer the Washington Armory is going. Is that through the month of April? I'm not sure.
I believe they were tentatively planning through May.
Oh, through May? Okay. So through May, I believe. So please, it's out there. The vaccine's available. Do your job. Be part of the solution, not part of the problem again. Our mental health support line is available 7 days a week, 8 a.m. to 5, 518-269-6634. It's going down a little bit. I was just talking to Dr. G the other day. He said now that, the last couple of days been really, or I should say the last week's been really quiet, which is good. It means people are starting to understand the new world we're in and adjusting to it, and which is great. But please, by all means, if your children need to call, you need to call. I don't care how little you think the issue might be, or might be a stupid question. Call. That's what they're there for. And please call. Our 24-hour sexual assault hotline is available as always. Area code 518-447-7716. To Karen Ziegler and her team, thank you as always, and for your inspiration and leadership to your whole team. Please stay safe out there. Wear your mask, cough into your arm, clean your hands 6 feet apart. Oh, you got the video, right? Oh, play the video, please.
Albany County Department of Health strives to protect and improve the health of individuals, families, and communities, utilizing strategies that reduce health disparities and promote health equity. We are a nationally accredited health department, having satisfied a rigorous accreditation process in 2019. Our department has 5 divisions that work together daily to implement programs and strategies to protect health in Albany County. The Division of Nursing includes our clinics: pediatric dental clinic, immunization, TB, and STI clinics, which serve thousands of Albany County residents every year. Our nurses conduct home visits to moms and babies in high-risk zip codes to teach about parenting and good health strategies. We also are tasked with management of reportable communicable diseases, including disease outbreak management, contact tracing, and interface with hospitals and community providers on disease management guidance. The Division of Public Health Planning and Education coordinates health education services and promotes risk reduction activities and health programs. The division reviews community health data, identifies community health priority, and develops community health implementation plans. The Division of Emergency Preparedness and Performance Management focuses on strengthening our capacity to respond to all types of hazards: infectious disease outbreaks, natural disasters, biological, chemical and radiologic incidents, and explosions. This division coordinates and maintains our Medical Reserve Corps, our vaccine clinics, and mobilizes citizens to help in public health emergencies. Our Division of Environmental Health provides many services to protect Albany County residents and visitors from potential hazards in our water supply, the air we breathe, and in places where we live, work, and play. This is accomplished by thorough inspections, sampling, investigation, enforcement of regulations that promote health and safety, engineering, and education. The Division for Finance and Administration provides department-wide support in procurement, accounts payable, accounts receivable, payroll, annual budget development, and expenditure tracking, grants oversight, corporate compliance, Medicaid billing, contract administration, and financial policies and procedures and audit support. This year, all of our divisions united to combat COVID-19. Our staff worked with other county employees and our Medical Reserve Corps to conduct case investigations, contact tracing, and provide much-needed support services to those individuals and families influenced by COVID-19. Our staff worked around the clock to ensure people had what they needed. This year, we've been happy to turn the corner and work with our many partners to promote and provide vaccination, the best strategy to end the global pandemic. Collectively, we have vaccinated over 40% of our population in Albany County and look forward to continuing these efforts to help our citizens get back to normal life. Thanks to all of you for your support, and please check out our website for further information on how our department can help you. As our colleagues at the State Health Department say, public health works.
That's awesome. Good job. Good job putting that together, Dr. Whalen. Thank you to you and your team for what you do. Extraordinary, 7 days a week, 365 days a year.